Good evening. We're moving on with part 4 of musculoskeletal system disorders. We're looking at inflammatory disorders this afternoon. Some of the inflammatory disorders we're looking at is Lyme disease, osteoarthritis, rheumatoid arthritis, gout, osteoporosis, and bone tumors. First, let's look at Lyme disease. The cause is usually from a tick. Signs and symptoms, we're looking at flu-like symptoms. You definitely have a bullseye, kind of a rash, and then he has the middle of it. So this all area here is all red. Pain, stiffness in joints and muscles. Once again, this is going to be a systemic inflammation going on. It can cause carditis and meningitis and peripheral neuritis. If this is not treated within a couple weeks, this can happen. Fatigue, cognitive problems, and arthralgia. The next one we're looking at is osteoarthritis. Once again, is a non-inflammatory degenerative joint disease. So risk factors are looking at heredity, age, being female, obesity, previous joint injuries and stuff. Signs and symptoms, usually you'll definitely have discomfort and stuff, but usually, let's see, usually have joint breaking down. Usually it's asymmetrical, so you have one joint and not both of them. Usually one or two of them, but not, it could be just the one instead. Chief complaint, aching, pain with joint movement, stiffness. It could be some deformities to it. Treatment, we're going to do pain management, like aspirin, Tylenol, and your NSAIDs. We're going to definitely work on strength training, aerobic exercise, weight reduction if the patient is overweight, maintenance of joint function, and alternative therapies as well. Nursing management, once again, balance exercise and rest. Using moist heat actually helps with circulation, soothe the joint area. Once again, trying to maintain weight within normal limits. Imagery, relaxation, and diversion. Do other things what we can do besides just medication for pain management. Moving on to rheumatoid arthritis. Once again, this is an inflammatory disease that has remissions and exacerbation, so it comes and goes. We have ankylosis, where it has the joint seems to freeze up, damage and atrophy of muscles. Pretty soon you have subcutaneous nodules, and it can affect your heart valves and your eyes as well. Signs and symptoms, you're going to have joint pain, warmth, edema, limitation of motion. It is symmetrical. Once again, it's going to do both hands and feet. It's more like systemic issues, and definitely a limited ADLs. Diagnosis, we're going to look at joints, pain for more than 6 weeks. We're looking at blood tests, your rheumatoid factor, your C-reactive protein, and your erythrocyte sedimentation rate. All those look at inflammation within the body. They also do x-rays, confirm cartilage destruction as well, and deformities. Treatment, once again, it's going to be pain relief. We're going to try to minimize joint destruction, promote joint function, and preserve what little ability they have. Preserve it. So here are some medications that they look at. NSAIDs, aspirins, steroids, methotrexate, gold compounds that they may use. There's other things they can use. Systemic corticosteroids Just remember, steroids always impact your blood sugar. It will rise and actually will limit your white blood cell functions as well and drop them down. So they're more susceptible to infection. More medications, maybe they'll have injections in the site. So once again, if it's not a systemic steroid, they'll have a local steroid being. Okay, so these medications then, if they have steroids directly into the joint, once again, remember, it's only temporary. We're going to be assessing for the site as well. And once again, this is just trying to manage the pain and the flare-up and trying to preserve the joint. Some of the clinical clues we're going to look at is monitor the pain patients taking NSAIDs, once again, for GI problems, assess for the liver, kidneys, and central nervous system function. Once again, these medications can impact. For the liver, we are going to watch the liver enzymes, kidney. We're going to look at labs that are BUN and creatinine. Watch the signs for blood dyscrasia. That is looking at your white blood cells, red blood cells, and your platelets as well. And then signs of toxicity appear. Once again, watching some of these medications can be detrimental to the patient. Older care points, once again, older patients with arthritis must be taught to watch for side effects. Dizziness predisposes them to falls. Once again, remember, they are not as flexible or agile. Their responses are slower, so they are higher risk for falls. Advising them to arise slowly as well, because you have orthostatic hypotension as well. And then help them use the assisted devices for ambulation, the walkers and the canes. Management, expected outcomes, we're trying to get pain under the control, medications, exercise within 2 weeks. Patient is able to get more mobile, improved within 3 weeks, and then demonstrate less disturbance of body image. Once again, they're more social within the month. Other implementation and evaluation for rheumatoid arthritis, once again, is rest and exercise. We're going to instruct them on joint protection, application of heat and cold, once again, help soothe, improve circulation, safety consideration, patient teaching, once again, not too long for the cold, not too long for the heat, what to do, what can we do for the diet, social care, what kind of family education should we be doing. Our next one is gout. Once again, it's all about uric acid levels elevated. Usually the purine diet, not able to metabolize that, so high purine diets is a problem. So we're going to instruct them on that, usually like turkeys and stuff like that. It usually affects the big toe. It's very, very painful. Signs and symptoms, you have a tight red skin over inflamed area, swelling just in that joint area. That's where like uric acid crystals seem to gravitate to. Diagnosis, maybe, the doc's going to do a physical examination and then do some lab work, which they're doing a serum uric acid. Treatment, we're going to be placed on NSAIDs like your ibuprofen for 2 to 5 days. If it's a chronic, we're probably going to put them on allopurinol, probenecid, oral urolic treatment. Once again, we need to teach these patients about these medications, about their diet, and making sure that appropriate fluid intake as well. Our next is osteoporosis. Once again, osteopenia is not enough bone density. Risk factors are age, chronic disease, medications, long-term calcium deficiency, vitamin D deficiency. Smoking is a big factor. Actually, they don't include this, but they should, hormones as well. Signs and symptoms, really, there's no early signs and symptoms. Possible later in life, they may lose height, maybe have a little bit of kyphosis, where the back vertebrae are shrinking and have little fractures, causing them to have a hump in the back, compression of the spine. You're going to have x-rays that they show, your DEXA x-rays, once again, bone density. They're going to look at and see, do you have osteoporosis? Treatment, we're going to stop bone density loss. We're going to increase bone formation and prevent fractures. So they may choose estrogen replacement therapy, but there's a lot of things against that. So they could be other things like dietary supplements. And remember, calcium, vitamin D, we've got to increase the water or fluids because you can have kidney stones. Doing weight-bearing exercise. Remember, the up and walking actually promotes bones to be more dense. Your biphosphonates, parathyroid hormones, once again, these biphosphonates could be taken, I believe it's once a month. Their parathyroid hormones, once again, if they've had a thyroidectomy, they might have removed their parathyroid by accident, so they may be needing replacement for that as well. Nursing management, once again, promote screening of osteoporosis, getting out there and getting a bone density scan. It's not painful, it's just real quick. Getting out there using calcium supplements and doing weight-bearing exercise like walking. Making sure that they understand the medications that they're using. Other cautions, remember, your proton pump inhibitors can impair you from absorbing calcium, so that could be a problem. And make sure that when they are taking some of those biphosphonate type drugs, that they keep upright for an hour, so they prevent this esophageal erosion and irritation. Last not least is our bone tumors. Once again, we have benign and malignant kind of tumors. Either one, malignant is going to move and grow and go into other parts of the body. A benign is usually encapsulated, stays right there. Let me see. Signs and symptoms, pain, warmth, and swelling. Diagnosis, they'll do x-rays, a bone scan, and biopsy. And then treatment could be surgery, radiation, chemo. Once again, this is a cancer. So surgery will be removing the tumor. Radiation is actually focused in on the area so other cancer tumor cells don't keep on growing. And chemotherapy is more of a systemic to catch any other cancer cells that could be out and causing more growth and metastasis.